all of the details, as usual, up to Dr. Lambert herself. We're looking at the signs and symptoms, the causes, diagnoses, treatment, complications, everything from A to Z on hand, foot, and mouth disease. First off, welcome again, Dr. Lambert. Seems like a much too long time since we've had you here.
Thank you, Tony, and it's good to be here once more. Good evening to all our viewers and listeners. And as Tony said, we'll be talking about hand, foot, and mouth disease. Now, it has recently been in the news a lot because we have it in our region. We heard reports of outbreaks in Jamaica and in the Cayman Islands. Now, the first thing you would wonder is where this all came from. It is a viral disease, and it has been around since the 1950s. Actually, in 1956, you had outbreaks in Singapore. We also had outbreaks from 2008 to 2010 in China. We had more recently in Alabama, USA in 2012, and also in Cambodia. And as recent as our 2015, we had also had outbreaks again in Singapore as well as in Jamaica and the Cayman Islands. So you realize it is closer to us now. All right, it's in our Caribbean region. So indeed, it's something that we need to be aware of. As Tony said, we're going to talk a lot about its cause, its symptoms, and all of that, so you will know what to look out for and what to do in case you think your child has it, because really and truly it affects mainly children under the age of 10 years. A lot of children, especially under the age of 5 years, indeed. But notwithstanding, it can affect adults as well. It's just usually, sometimes it's very mild in adults, and they don't even know that they actually had it. Or in the case of an adult who is immunocompromised, meaning somebody who has another chronic illness, sometimes like diabetes, if the person has HIV or cancer where the immune system is weakened, of course, they also can be affected by it, and they can have the disease in its severity.
I'm taking it that before you go on about the children, the particular manifestation in children is that because children's immune systems are still developing, that they tend to be particularly vulnerable.
Not so much. In a lot of cases, yes, but in this case mainly, the main thing is how is it transmitted. So when we talk about how is it transmitted, you'll see why it is that it tends to affect a lot of the children and less the adults.
And one more thing before moving into that, I've noticed in terms of the history, the various states that you have been, it almost seems as if it's been coming in surges sort of thing. Is that the nature of a viral infection or what?
No, it's the nature of a highly contagious infection. Okay, and a lot of the highly contagious infections are viral. So we're saying that the cause of hand, foot, and mouth disease is viral. Okay, what are the viruses that can cause it? It can cause the most frequent virus that causes hand, foot, and mouth disease is a virus that we refer to as the Coxsackie virus. So you will hear somebody saying, instead of hand, foot, and mouth, they say Coxsackie virus. And the type that causes it more frequently is a certain number, because we have different strains of it that can cause the virus as well. Now, besides Coxsackie, we can have other enteroviruses that can cause hand, foot, and mouth disease, but Coxsackie will be the most frequent one. So we understand, yes, it is a virus. Now, so what is this hand, foot, and mouth disease? Now, there's a good reason why they call it hand, foot, and mouth disease, because it's characterized by you having little rashes, ulcers around the mouth. That's why we have the mouth part of it, all right? Whether it is outside or inside the mouth, you can have it in the hand, the foot, and besides the hand, foot, and mouth, you can also have those lesions, in the genital area and to a lesser extent on the limbs and trunk. So that's the reason why it got the name of hand, foot, and mouth disease. Now, also for you farmers out there, you may be wondering, hand, foot, and mouth disease, isn't there a disease with a similar name that affects livestock? Indeed. there is. All right, I think it's hoof and mouth disease. Now, it's also caused by a virus, but luckily for us, this virus does not affect us. For instance, the virus that causes the hoof and mouth disease in the animals, it only causes that in the animals. And just the same, the Coxsackie virus that causes hand, foot, and mouth disease in human beings does not affect the animals. So they have similar names, but it's different viruses acting in this case. So what do you expect? Usually, as many of the viral illnesses, it will start off with a fever. And the child not feeling well, what we call malaise. Sometimes they're just irritable and all of that, with loss of appetite and all of that. And now, a hallmark of it is sometimes the child doesn't want to drink. And when you inspect the mouth, you realize there are little blisters in the mouth and throat. So obviously these are quite painful, so that's the reason why they sometimes don't want to eat or drink. These lesions can be around the mouth itself, the mouth and the opening of the nose, as well as I said, you can have it on the hands. We can have blisters and vesicles with clear fluids. Under the feet and in the hand, you can have a reddish rash. Now, this rash is usually not very itchy, but of course, with children, any little rash, they tend to scratch at it and pick at it, really. But for instance, the lesions in the mouth can be quite painful. So you ask yourself, if I get exposed to this Coxsackie virus that we're talking about, how long after would I start having those lesions that we just mentioned? Usually, there's what we call an incubation period, the period between the exposure and you starting to have some of the symptoms of about 3 to 6 days. Now, as I said, it's highly contagious. So, when I say highly contagious, meaning, as we see on the street, it's really catching. So it is a big thing, and that's the reason why we have, you notice I mentioned outbreaks before in all these countries. Okay, that means there's a significant number of cases within a certain population in a given time. Now, when is this hand, foot, and mouth frequent? In the temperate regions, the regions that have the different seasons, it tends to be in the summer, and the fall. But of course, we don't have this kind of definitive seasons here, so we can have it all year round. Now, I know you're concerned out there because you're hearing about the word outbreak, epidemic, and so on. Again, all that depends a lot on us when we talk about the measures of prevention to try to avoid the spread of the disease if and when it is present in our society. Now, Tony, you ask a very important question, the question about why the children. Why the children? Because children indeed will be children. Why when I say that? Think about a daycare setting.
All right.
They share all the toys, they hug and kiss. Although sometimes you try to make sure they have their own utensils, but they are kids, so they will share. All right. Now again, sometimes the hand washing could never be adequate because the hand is on the floor on different surfaces. And where do the kids put their hands? In the mouth. So here we go to talk about the mode of transmission. A lot of the mode of transmission is from person to person. So let's see what I mean by person to person. It means that if you come in contact with, for instance, saliva and like nasal secretion from an infected person, you can get the disease. That's one. But remember, we also talked about you having these lesions on the skin, the blisters. And so if the secretion from those blisters, again, if you come in direct contact with them, and it's not just you in direct contact with the person per se, but let us suppose the person has been using the surface here. Remember, they can contaminate the surface as well. So one of the things when we looking at the preventative measures is a lot of hygiene, washing hands. And we have been through this a lot already, that when we're talking about viral illness, we talk about frequently washing hands and keeping surfaces clean. And in the case of the children, of course, you will have to keep their toys and utensils clean with frequent washing as well.
Now, when you say frequent, just give us a rough idea about it for every day. How often you are talking about cleaning these things?
Well, that is a tough question, because remember
rough average.
Because remember we were talking about a daycare setting. Because remember, if your child is one child at home, of course you will clean as well, but maybe you won't have to clean as much. Now, as I was going, before I forget, where we were mentioning the methods of transmission, another important point, and something that happens frequently at home too, but in daycare frequently, is you having to change the diaper of the child. And it is also spread through stool.
Okay.
So remember, when I say clean the surfaces, I'm talking about, now these measures should be in place, but you should be extra vigilant now. For instance, after you would have changed one child, you're supposed to wash your hands and also disinfect the surface on which you would have changed the child. So in terms of the how frequent, it depends on what is happening. So let us suppose, for instance, you have the child to change. Usually you have a change area. You change this child, you wash out your hands, you clean the surface, and then you could go ahead to change the next child.
Mm-hmm.
Again, the toys and so that everybody is using, I guess as much you will clean it daily. But the idea is, as we're talking about the symptoms, what we want is that for people to suspect that it is hand, foot, and mouth disease. Because if, for instance, you're in a daycare setting, or even you're at home and you're suspecting that your child have hand, foot, and mouth disease, then you know that child is not fit to go to the daycare or preschool setting. Of course. Why? Because it is contagious.
Right. And yet, of course, many parents, and under duress and everything, they have to get to work and whatnot, may just choose to, well, for us, we can say do the irresponsible thing, and yet still they are thinking, well, what else am I supposed to do?
Yes, sometimes it's a tough decision, but that's the reason why it's not only, we're not speaking out there just to the parents, but we also speaking to the teachers and the caregivers as well.
Mm-hmm.
Because remember, what we're trying to do is prevent an outbreak. So, for instance, if the mother may recognize it and yes, pretend she didn't see it and bring the child. But remember, you are in close contact with these small children, the children of the preschool and the children of the daycare age. You were in closer contact with them. Maybe with the bigger children, they may get away for a longer period. And remember, a lot of the time, the child doesn't feel good as well. So they sometimes will complain to you that they're not feeling well in school. So you look out for this. Now, already we have the teachers out there, because that's not the only contagious disease we have. They usually look out for rashes and so, and inform parents that they need to take their child to doctor to see if whatever rash they have is contagious or not. And that is the responsible thing to do, because if the child comes with something contagious, it can spread among everyone in the classroom, plus any child that is in contact with that child, as well as people using the surfaces. And surfaces don't even have to be just toilet area, you know, because remember, we all have to touch the doorknobs and all of those things. Mm-hmm. So that's why we're talking about disinfecting frequently. You can't say like the amount of time to do it, but remember, you have kids running around, touching doorknobs and all of that. So yes, you go about
their children.
Of course, mm-hmm. and touching all around. So you have to try to keep these surfaces clean. So we're saying here the important thing about hand, foot, and mouth is we're preventing our children, and for the few adults that will have it, from having a disease that can be quite uncomfortable. The rashes, the blisters in the mouth, remember, anything there that can be painful, preventing us from eating. Besides that, you can have fever. Some children will even have nausea and vomiting with it. So it's not something very pleasant to have, and something also that can be spread to other people, both in the household, in the school setting, and so that we're trying to work on the prevention of this disease. So the question out there, because I mentioned that we have it in Jamaica and the Cayman Islands have reported cases, what about Grenada? Now, one of the things with hand, foot, and mouth disease is sometimes we suspect it is hand, foot, and mouth disease because in most cases, there is tests out there to confirm it, but usually these tests are expensive, and not only that, you won't get it right away. It's cultures, you have to be sent out. Our labs here don't do those cultures. It's usually sent out to the Caribbean lab to get it done. And it will take a while. All right. So it will take a while for us to get the result. Now, you may wonder if it takes a while to get the result. So how do we know? Actually, it can be diagnosed from this history and symptoms. But why do we need confirmation? It's important to know what strain of the virus is causing it in your region. It's quite important to know. And if there's any differences, for instance, with your hand, foot, and mouth, how it's presented in our region as opposed to how it is in Singapore, in China, and all of those places. So I know the question on your mind out there is, we have vaccines for mumps and all of those things, so why not a vaccine for hand, foot, and mouth disease? Unfortunately, they have not developed a vaccine for hand, foot, and mouth disease as yet.
And so the obvious question is, then, in the absence of a vaccine, what do we do apart from keeping things so super clean? Well, I'll tell you what, that and all other things as much as possible to do with hand, foot, and mouth disease, we still have to come your way right here on Doctor On Call with Dr. Susan Lambert. So do stay tuned. We'll be back with you after these words from some very kind sponsors.
Just like a best friend, a good pharmacy should be caring, within reach, and interested in your health and happiness. Hills and Valley Pharmacy in St. George's and Carriacou is your safe bet for efficient customer service, affordable prices on great products, herbal vitamins, skincare products, baby products like Aveeno E45 and Oilatam, and hard-to-find names like Pronamel for adults and children. Hills and Valley will also source hard-to-find products. Hills and Valley Pharmacy, located on Halifax Street in St. George's and Church Street in Carriacou. Opening hours 8 a.m. to 7 p.m. Monday to Saturday. Hills and Valley Pharmacy. Your health is our business.
Do you have what it takes? Are you ready? Ready or not, Quartz kicks off the season with our unbeatable deals featuring the world's best brands. Buy any Whirlpool product for a chance to win $10,000. Choose your own free gift with furniture purchases $499 and over. Shop with Ready Finance and pay nothing until January 2016 on credit accounts 24 months and over. Don't miss the action. It's game on at Quartz.
And back now on the program, Doctor On Call, and looking at hand, foot, and mouth disease, and especially affecting our children. Dr. Susan Lambert, well, where we last left off, unfortunately, there is no vaccine for this. So apart from keeping everything clean, what do we do?
Yes. So I know you're concerned. All I'm talking about is keeping things clean. Now that idea of maintaining proper hygiene have been around for a long time, and you realize that it not only works for hand, foot, and mouth disease, it works for a lot of the viral illnesses. Because remember, hand, foot, and mouth, besides just the secretions, as I said, from the nose, and so if I talk secretion from the mouth, remember again, if you cough and you sneeze, these droplets are in the airborne, and you can get it from that as well. So it's our good methods of hygiene where we say we wash hands frequently. Remember, we talked in one of the programs when we sneeze in or coughing, we learn to try to do it in the by the elbows rather than in the hands, because you realize it's the hands that we touch all the surfaces with, that we shake hands with, and all of those things. So these are some of the things that you do, and they are just simple, trying to keep things clean as normal. So you may ask, you're talking about so much of washing hands all the time. Suppose I'm not where we have like a pipe with running water to wash hands. Now, for the mother out there, she has an answer for that already, because usually to do all the diaper changes and all of that, they usually have wipes. So you can use wipes to clean the hand as well. And what else? We have the hand sanitizers as well that we can use. Okay. Of course, there's nothing like soap and water, but those also can be used. As to the surfaces, you wonder what am I going to use this to clean the surfaces? Now again, the same soap and water. You clean out at first, you wash out the area, and you can use diluted chlorine bleach to clean the area. Notice I said diluted, because obviously you won't use undiluted chlorine bleach to clean your surfaces, because we're talking about both you and the children using those surfaces. And so these are some of the main things that we really need to do. Now, out there we were talking about all those symptoms that the child will have. So you may wonder, well, if my child is not feeling well, my child is hardly drinking anything, what do I do? Remember, we also have the fever on board sometimes. Now, the reason why they're not drinking much, one, of course, they're not feeling good, and two, the pain in the mouth. So if you're going to give them like hot food or hard things to chew, there's no way they're going to take it. But you can give them cool drinks, even little ice chips, okay, cool water, and so. Now, what about the juices? Now, remember, the juices, a lot of them are acidic. So just imagine if you have blisters in your mouth, what will happen? So you have to try to give less acidic things. Some you can give them, if they use milk, the milk products, and so that with less acid. Now, also, it is important, for instance, especially the child with lots of blisters in the mouth, that we hydrate that child. Because one of the complications will be if the child is not taking anything, dehydration. And this is a topic that we always seem to come back on, dehydration, because dehydration could be fatal if we leave it unattended. So what do you do? Yes, they would not want to drink a lot, but you give them sips frequently. Now, there are times when you try all those things and nothing seems to be working, then it's time to see your doctor or nurse for some help. It is time to see them. So don't leave the child there for days, not taking even some water at home. Because by the time we see them, they will be severely dehydrated. So let us try to prevent dehydration. So what we're saying here is, I'm talking about doing what we call symptomatic treatment. Because in the case of the viral diseases, you know that we don't need any antibiotics. They are self-limited. It's going to go between about 7 to 10 days on its own, but you have to make the child comfortable. So for the fever and for the pain, you can give Tylenol, Panadol. Sometimes we have the Paramol or even the ibuprofen. One of the things you should avoid giving them, though, is aspirin. Because aspirin and viral disease, there is something called, in some cases, a complication called Reye syndrome that can occur that you really need to avoid. So hence, you try to avoid aspirin, but you can give any of the acetaminophen. That would be the Tylenol, the Paramol, the paracetamol, the Panadol, or the ibuprofen, and that will help with the pain as well as the fever.
And before you go on, Doctor, I believe we do have a call. We say good evening to you, caller.
Good evening.
Hello?
Afternoon.
Yes,
Hello.
good night. Welcome to the program.
If your belly hot in here a lot of time, what should you do?
Can you speak more loudly for us?
If your belly hot in here every night, what you should do?
You're asking that question in terms of a child with hand, foot, and mouth, or it's a separate question you're asking?
Separate.
Okay, so tonight we deal with hand, foot, and mouth. But usually I'll give a short answer and then we will deal with it in a future program. Now, if every night you have an abdominal pain, it could be many things. Now, it depends on which part of your belly is hurting. That will kind of give you an indication of possibly what you may have. Now, let me give an example. Now, if you say every night, so it possibly is not something acute. Suppose it's right in the as we call it, in the mouth of your stomach that's hurting you every night. Is it that it's hurting when you eat food, or when is it that you're hungry? It could be something like ulcers that can have it. Now, if, for instance, it's on the right side of your abdomen, it could be that you have gallstones. So there are many things that can cause it. But we can deal with abdominal pain in another setting. Tonight, what we're talking about is hand, foot, and mouth disease. So if you have any questions to ask pertaining to hand, foot, and mouth disease, you can go ahead and ask it, or else we'll deal with abdominal pain in detail in another program.
Right, thank you.
Okay,
All right, my dear.
thank you, caller. Yes, so you were talking about the various medications that can be given to children. Definitely not aspirin.
So we want to avoid aspirin. So what we're saying is we're trying to make them more comfortable. So the child should be hydrated, give him lots to drink. Because we know of the blisters in the mouth and how painful they can be, when we giving them food, we don't give them any hard or rough food at that time. We try to give them soft, smooth food and lots of liquid. Of course, they will need calories, so it's not just water. All right, and we try to avoid acidic, and not only acidic, peppery and salty foods, because all that will irritate the mouth. Now, dealing with the blisters in the mouth, again, according to the age of the child, of course, some of them can do gargles already. All right, so if they can do gargles, we can use as simple as warm salt water for them to gargle. The others that can gargle, you can wash out the mouth frequently with warm water. Now, that is an aim to soothe the inflammation that is caused by these blisters within the mouth.
One question, while you say hand, foot, and mouth, just how far into the mouth can these blisters go? Can they actually go down the throat too?
They could be as far as the back of the throat. So you know that it could be very uncomfortable for swallowing and all of that. So that's why we really have to look out for that child not wanting to eat or drink anything, because it could be very uncomfortable.
Really affect the swallowing.
Now, besides that, remember, we can have the blisters all over the skin, like around the mouth, around the lips, and at the entry of the nose as well. We can have them there. And as I said, we look out for the hands. And when we say the hands, even inside the hands, usually inside the hands, what you will see is a red rash, like dots in the hand and under the feet as well. So you look out for those. But you can have the blisters, yes, on the limbs and especially in the younger children, in the genital region as well, you can have those blisters in that area. Now remember, it's not just blisters. We start off with vesicles, with cleft fluid. They will burst and form these blisters on the skin. Now, in terms of the rash, what do you do for the rash? Really and truly, all you want to do is to soothe the rash. Of course, you don't want to use no strong soaps and all of those things that will irritate it and cause it to burn the child. So you can use your usual mild soap and water, pat dry the skin. If there is itching, and as I said, with hand, foot, and mouth, it's not so much characterized by itching, but there could be some itching. We can use things like calamine lotion on the skin to soothe the skin, to lessen the itching, because usually we don't need any antibiotic or anything. Now, these, of course, when we have a rash on our kids' skin, we find it ugly and we want it to go away right away. I'm telling you that this one will disappear on its own within 7 to 10 days.
Okay. Oh, that's pretty quick, actually.
Well, Tony, maybe for you, but
Well,
most parents are going crazy. All right.
Right.
Yes,
Yeah.
because one, the child is uncomfortable with it. You see this open oozing on the skin. No way, you don't like it.
One thing that I was thinking, though, in terms of a concern, well, I'm going to have to hold on to that. We have another caller here. Good evening, caller. Welcome to the program.
Yes, good afternoon.
Good evening.
Doc, this put on hand and mouth you're talking about, I knew it a few years ago. I had 5 children, and they go to bed early in the morning, they go to bed in the night, and they wake up in the morning, and they get up, Mommy, my mouth hurting me. When I look, the side of them mouth swell up red. And they had fester between the teeth. And when I smell it, I had to pull back my breath. It smelled so bad, and the hand was red. I say, Lord, what am I going to do with them children to bring all of them to the doctor? So I go by Mr. Kittens, and I explain to him. And he said, okay, don't panic, don't worry. And he gives me a little white syrup, thick, like honey, but it's white. And he tell me, put it in a little saucer, a little glass, but don't use the same piece of cotton in the thing. Every time, change the cotton. And I change the cotton, and I wipe them out and things. And when this, in a daytime, it was, the mouth was good. They couldn't eat, they couldn't drink water, they couldn't do nothing. And if I could just give me a syrup, a little syrup mix up, and he give me, because most time I used to go to him and explain like a doctor, and giving me the medicine. And it worked very well. So I know about that long. So long one child have it, all having it, because they play together, and it's painful. It swell up their mouth and everything. And you have these children, so you must feel bad. You don't know what to do, because you want to know what's going on. Yes? So I know about it. Yes, it was there a few years. Yes. So I know about that. It's real bad. But it's only children we don't have it.
But it's not only children, it's mainly children that have it. It's mainly children. Yes. But some adults could have it as well. Yes. But it's mainly a disease of children less than 10 years, and you see it mostly in the children less than 5 years. Yes. Now, thank you for telling us about it.
Yes.
And so, now, as the caller mentioned, she mentioned something important, that, for instance, the children was having discomfort in the mouth and all of that. Because later on, she brought up a good point. We will realize that hand, foot, and mouth disease is not the only disease that can cause blisters in the mouth. So we are going to talk about that a little bit later. What other diseases can possibly give you those blisters, and what do you have to look out for? Now, the idea is, if we're talking about us having hand, foot, and mouth in the region, we have to look out for it. But remember, not every case of having blisters in the mouth and all of that will be hand, foot, and mouth disease.
So that sharp eye that we need to differentiate one from the other, we'll be taking a closer look at right here on Doctor On Call. Of course, right here on GBN TV, Channel 7 and 11, and sister station K105. We'll be right back with you. Your telephone calls, more from Dr. Susan Lambert after these words. Stay tuned.
Somebody tell me the steam come inside here. You go see me and him today. What you doing here? I thought you come downtown to go and do your blood test.
Yes, ma'am.
So why didn't you just go to the doctor and go to the lab as you are accustomed?
I done that. From now on is one stop I making at the Spice Imaging Center on the Carenage.
So you have doctor and lab here?
Of course it have doctor here. And once the doctor diagnose your problem, whether it's test or scan, they're doing it right here in the brand new state-of-the-art lab. And furthermore, if you have to get medication, the pharmacy and all they right here.
Oh yes, Spice Imaging Center offers CT scans, MRI, ultrasound, ECG, and many other radiology scans, lab services such as prostate test, cancer markers, etc. Also offers physical therapy and opens on Saturdays just for your convenience.
Inside here so nice and accommodating. I'm going to be back tomorrow, please God, man.
Spice Isle Imaging Center.
Are you ready? Do you have what it takes? Ready or not, Quartz kicks off the season with our unbeatable deals, like the City Scene Sectional for only $2,599 or $27 weekly. Buy this product for a chance to win that purchase absolutely free, or save $500 when you purchase the Merlot 7-piece dining set for only $4,399 or $46 weekly. Don't miss the action. It's game on at Quartz.
Hand, foot, and mouth disease. Or is it always the difference? What do we look out for? When is it? When is it not? Back to you, Dr. Susan Lambert.
Yes, so you remember we mentioned that hand, foot, and mouth is a viral disease. Now, there are a lot of viral diseases out there, and a lot of them are characterized by having, among other things, a rash. Now, some can have lesions in the mouth, some do not have lesions in the mouth, as well as some will have all over the body. Now, in terms of hand, foot, and mouth disease, when we think about it and we're thinking about those lesions that come out on the body, one of the other things that we think about is things like, for instance, chicken pox. Because, again, we have chicken pox, and chicken pox, sometimes you start off with flu-like symptoms like the fever, sometimes a little cough, sneezing, runny nose, just the same, and later on, you find that these papules are coming out on your skin all over. And they can come out all over. When I say all over, they can start on the face, they could be around the mouth, and all of those things as well. So usually, how in these cases, especially like for instance among these viruses, what do? We look at the characteristic of the rash. That's the reason why I mentioned for the diagnosis of hand, foot, and mouth diseases, usually we don't have to send out a lab test. To say that somebody has chicken pox, we don't usually have to send out a lab test. Now, it's important that we do lab tests, even if we cannot do on everybody, for us to know the strain of the virus in our area that's causing the disease. But you can make a diagnosis without. Now, of course, there are sometimes cases that can be more or less tricky. They look like something else, but it's not exactly that. So, again, doing these confirmation tests can help you to confirm whether indeed what you're thinking was a certain disease is indeed that disease. So, really and truly, you look out for the characteristics. You realize that some of them can be similar. Now, notwithstanding again, we were talking about the mouth. But remember, hand, foot, and mouth is not just the mouth. That's why you say hand, foot, and mouth. Now, everything do not go like the books, because some people sometimes don't even have no blister in their mouth. They just have the lesions around the lip and at the entrance of the nose and all of that. But, for instance, when we find a child not drinking, and we look in the mouth and we see blisters or we see lesions in the mouth, not every time it will be hand, foot, and mouth. So, for instance, if you look into the mouth, common in young children, what we call thrush on the street, candidiasis of the mouth, that the child, the mouth seemed to be reddish with a white coating on the tongue and even on the gums and the mucosa of the mouth, again, the child will react the same way. The mouth will be very irritated, so they may not want to eat or drink. But of course, that lesion will be in the mouth only. But with hand, foot, and mouth, you look out for lesions in the hand, the foot as well. So that can give you an indication that in this case it's not hand, foot, and mouth, because the lesion is mainly in the mouth, and you have characteristics that you would not find in hand, foot, and mouth. So you realize that a lot of the viral diseases, yes, have rashes, but each of them will have their characteristics. Some will be similar, so sometimes in the beginning you may think it's one of them, but it's not. But something you have to realize is there should be no fear, because usually when we talk about viral diseases, we normally don't talk about antibiotics and all of those things. We think about one set of treatment, which we call symptomatic treatment, making the person comfortable, giving them lots of fluids, keeping the rules of hygiene so that you don't transmit the disease.
Now, taking a little more about the rules of hygiene, because, all right, since the end of Carnival, usually after Carnival, after Christmas, we are left with some cold or something here. And as far as I'm concerned, we have had a bad cold going around since after Carnival. It's just been recurring, going on and on and on and on, never quite leaving us. In terms of that, in connection with hand, foot, and mouth disease. So, your child gets it, child gets through with it, gets onto the school bus to go back to school, and with the other students, there is some other child on the bus, and your child gets it again. And then who knows, again and again and again. What then? What happens?
Okay, I like that question. It's a wonderful question. I know a lot of persons are thinking about it. You can develop immunity to hand, foot, and mouth disease, so that's a good thing. But it does not mean that you cannot have it more than once. So you must be saying that I'm putting my foot in my mouth there, right? Because on one end, I'm telling you can develop immunity, and on the other end, I'm telling you that you can catch it more than once. Well, yes. Let's go over that again. You can catch it more than once, but usually you will develop immunity at some point in time. So that's the reason why you tend to notice that we have children less than 10 years old that will be mainly affected, because the older person tend to have developed immunity already. But there's no hard and fast rule that if you had it once, you can't have it twice. So that's what I want to point out there. You will develop immunity. Some people on only one attack of the hand, foot, and mouth, but others may not right away, so they may have it a second time.
Our time really tends to fly extra quickly on this program, but another thing I'm wondering about, especially with the sores in the mouth. One other thing of great concern, dental hygiene. So you don't want to even drink certain things, if drink at all. You can't get the child to brush their teeth, and that's very important too. You're sort of between a rock and a hard place. How do you deal with something like that?
Well, that's where we go back to the area when they were small. When they were smaller, you were not using a toothbrush. You were using a rag with warm water and so to clean the mouth, right? So you're going back to do that. Of course, it may not be a pleasant something, but you have to do it, because remember, the mouth is tender. So that's the reason why, remember, we mentioned that you can give them the Tylenol, the paracetamol, the ibuprofen to help with that pain in the mouth as well. But you have to clean it, and that's why we're talking about cleaning with warm water. You don't have to use any strong mouthwashes or so that will irritate these open blisters even more, but you can use warm water. For the bigger ones that can gargle, after cleaning the tongue and so with the rag, you can give them warm salt water to gargle how many times per day you want, because they are not going to swallow it, they're going to spit it out, all right? But for the smaller ones that they can't gargle as yet, you just clean that mouth frequently. Of course, you may not get much cooperation, but it's something that you have to do. Because remember, out there, we talk about viral infections, but again, infections can be very opportunistic. Because if we have these open blisters, remember, caused by a virus, yes, but we don't clean them out, what do you think will happen? We will have a bacterial infection or even a fungal infection superimposing over that viral infection. So that's the reason why you have to clean even though. Now again, the skin, we need to bathe them. Of course, I said you don't use your strong soaps on the skin to burn them up so they will be itching and all that. The other thing is, children, when they have lesions on the skin, like to pick it. All right, so you have to try to avoid them picking and scratching. That's why I said you can use soothing things like calamine lotion on the skin, all right, so that they would not be putting their fingers into it. Because remember, when they put their fingers, what we're looking at there now is that lesion that we don't normally have to give antibiotics for, because they would have gotten infected by bacteria now. Then we have to be working with a viral infection that is superimposed by bacterial infection. Okay. So that's the reason why you want to keep everything nice and clean, not using any irritating substances to make them scratch or dig these lesions on the skin. Now, remember, the light at the end of the tunnel here is that in 7 to 10 days, these lesions will be gone. Now, a very important point that I need to deal with here is, remember, we're talking about children, school children or preschool daycare. So the question is, how long are you expected to keep these children home? All right? Usually about 10 days. Usually about 10 days. Now, it's important that you know that, for instance, all the lesions could be cleared up and the person could still be transmitting the virus. Okay, from in the saliva and so on. As a matter of fact, it stays very long in the stool. It can remain there for about a whole month. So that is the reason. Yes. Okay. And of course, we're not saying keep the child home for a month. So it means, therefore, that's the reason why we come back to that word hygiene. Wash those hands. Okay. And a lot for adults, most of us, when we go to the bathroom, it's a norm for us to wash our hands. But again, as a caregiver, if we're not meticulous, we may not. You have a couple children waiting to change, and you may wash your hands in between changing each child, but remember, are you cleaning up the surface? Because remember, when you're changing diapers, you usually have a surface where you put the child lie down. What are you cleaning the surface after each child? All of those things need to come in questions, because we are saying here that a child could have no lesions and the virus can be alive in the stool for a whole month.
I suppose too. I mean, when you have the older children, you're also talking about potties. You're talking about toilets when it comes to
that's why it's so difficult. Because remember, you remember for you parents out there how difficult it is with potty training. And potty training, this is not, we're not talking about home with you and one child. We're talking about a child in the daycare and all of that. Though you have them and you have them the specific area to go in, separating the children to go in a specific potty, sometimes it could be challenging. Right. So all of those things. So it's a lot, yes, but we really need to maintain. Now, of course, these institutions do have their rules for hygiene, the cleaning up and all of those things. But what we're saying is enforce those rules, because besides these rules being on paper, I want you out there to understand why those rules. The other thing that we have not talked about, we mentioned, for instance, the symptoms, the cause. We mentioned treatment, and we said treatment will be symptomatic treatment, and we mentioned the biggest area is prevention, that is maintaining proper hygiene, hand washing, cleaning of the surfaces. But we did not mention complications. Now, one of the more frequent complications, as I said, will be dehydration. Why? Because, of course, if the child is refusing to eat or drink, and that continues for a while without you giving them their little sips continuously, and so they will become dehydrated. And as we said, now if you find that you're not making headway with that child taking in anything, whether it's food or drink, seek help. See your doctor, see your nurse to get some advice and help with that child. Not only that, we're talking about a disease that has fever as well. If you find that you're not controlling the fever, because you can use the lukewarm baths as well as using the Tylenol, the paracetamol, and the ibuprofen for the fever. But if you find that you're not controlling the temperature, then also you can seek help. So what are these complications that I'm going to talk about? First of all, I must mention dehydration, yes, would be the most frequent. The others are rare. But remember, although it's rare, when it happens to our child, okay.
Why leave it to chance to begin?
Of course.
Yeah.
So in a few cases, it has been reported that people will have meningitis. All right, that is inflammation of that layer that surrounds the brain as well as the spinal fluid. Now we also can have what we call encephalitis, that is the brain itself being inflamed. So we realize we're talking serious business here. All right. Now, as I said, it is rare. So I don't want you to panic out there, because we have the weapon against all of that: prevention. All right. Those are some of the main things that we have to look out for. They are quite rare. Now, another thing that they notice, and they don't really know the relation between hand, foot, and mouth disease and this, but sometimes about 4 to 8 weeks after having hand, foot, and mouth disease, the child will lose all of their nails, fingernails, and toenails. So, of course, as a parent, you'll be very concerned that they all just drop out. All right? The good thing about it is the child doesn't need any treatment for that, because they will grow back as normal. But it has been noted throughout the years that has been happening with some children. Of course, they cannot explain the whole relation with it, but it's something that have been noticed. But as I said, do not hesitate to ask questions of your health professionals, your nurses, your doctors, and so do not hesitate to ask for help. You're concerned the child has a rash, you're hearing about hand, foot, and mouth, and you want to know about it, you can come in, speak to nurse, see doctor, and so. But it's not something that you need to be in a mad rush. You see, for instance, the child has a mild fever. As we usually say, when the child starts off with a mild fever, that's not the time to rush. Because remember, all the viral illnesses will start off with the mild fever. But of course, you control the temperature. Now, if it's lasting for more than 2 days, or you're not controlling the temperature, and you're seeing that, for instance, in the case we mentioned, that a child is not eating, not drinking, then you need help. You need to seek help. Take the child to the medical station, your family doctor, or so, for help. Or if it's like holiday weekend period, you can call the emergency room to ask for advice, or go to the emergency room. But the idea is, it is not something that you see the child with a mild fever and you see those blisters coming out, that you have to rush to emergency room.
Well, doctor, on that note, we just have to wrap things up right here. But another good thing about this is, whatever questions have not been answered, very concerned parents, I'm sure you can still get your answers by going on to our website. And to get there,
the K105 Facebook page, you can inbox us, and we usually respond to your questions, as well as take your suggestion for other future topics. Now, I must apologize. Remember, we had promised to do uterine fibroids. We will do it. It's just that, as the idea of having hand, foot, and mouth right in the Caribbean here with us, we thought it was quite important to talk about it.
Oh, yes.
So it's not that uterine fibroids is not important as well, but as this is a current situation, we decided to deal with it, but we are going to deal with that topic in the future. So to sum up here, prevention is the key. And what is prevention? No, it's nothing new. It's something that we all know. Wash our hands properly after using the bathroom. Wash our hands before handling foods. Wash our hands a lot when dealing with children, as well as remember to clean those surfaces. Keep the surfaces clean as well. So we're saying practice good hygiene for the prevention of viral diseases, especially in this case, hand, foot, and mouth disease. And as a note out there, parents, I know it's difficult, but remember, if you suspect your child has hand, foot, and mouth disease, remember that child should not be taken to the daycare, should not be taken to school. Teachers as well, keep your eyes open for it.
And so we once again, listeners, viewers, thank Dr. Susan Lambert so very much for the latest program, Doctor On Call. We dealt with the hand, foot, and mouth disease. You've certainly been hearing about it in the news. And remember, any other questions can be dealt with through our website. Dr. Lambert is going to be back with us, good Lord willing, next week, Tuesday evening. And that's going to be from 8:30. I'm Tony Julian, thanking you for having tuned in, and also thanking our very kind sponsors.
Doctor On Call was brought to you by Bryden and Miners, Hills and Valley Pharmacy, and Spice Isle Imaging Center.